الحمد لله نستعينه ونستغفره ونعوذ بالله من شرور أنفسنا ومن سيئات أعمالنا من يهده الله فلا مضل له ومن يضلله فلا هادي له ونشهد أن لا إله إلا الله ونشهد أن سيدنا مولانا محمدا عبده ورسوله صلى الله تعالى آله وأصحابه وسلم تسليما كثيرا كثيرا. سبحانك لا علم لنا إلا ما علمتنا إنك أنت العليم الحكيم. ربي اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقه قولي. Assalamu alaikum wa rahmatullahi wa barakatuh, and welcome to our session related to COVID-19. And this particular session, in essence, related to the topic of the Islamic Fiqh Guidelines Toolkit for managing epidemics and pandemics. So this particular session is focused mainly for Sharia scholars, imams, general Muslim population, and Muslim institutes and organizations. And the reason why we thought that this session was important was to address a couple of concerns, primarily. And secondly, to inform us about important issues that we need to recognize and understand before we start making judgments, before we start producing fiqh verdicts, and even before we start having those internal discussions amongst our family members and others around us on very, very important issues related to this pandemic crisis that we're currently going through. Bi-iznillah, it's all through Allah's permission that these things happen. So we turn to Allah subhanahu wa ta'ala in all ways in addressing this concern. Let me begin first by just highlighting what I'm going to talk about. So there's quite a lot of things there, but generally speaking, what I'm going to do is I'm going to highlight some very important features about the whole discussion related to epidemics and pandemics. There are some real important lessons that we're learning that need to be preserved. And these lessons are for future generations, if not us, even in our lifetime, when a similar thing ever occurs, that we are prepared from the fiqh perspective, and also as Muslims who are pre-planned, and we have a good understanding about what the right thing is in this particular occasion. We cannot afford to make any mistakes as Muslims, because this is something that will be recorded in history. The current climate that we're actually going through will be something recorded in history that generations from generations after us will look back and see how we reacted and how we behaved in such a circumstance. For that reason, it's important that whatever we do, we have a very clear, what we call Islamic approach to this. And also we have a very clear approach in the sense that this is setting a precedent for future generations to follow and to take heed. So on that basis, I'm going to talk about a couple of things. I'm going to first talk about the idea, what is epidemic, what are pandemics? We were using these terms quite a lot. So what does it actually mean? Then the second part of this is related to the subject of infodemics. And infodemics is a very new term that the World Health Organization has started sort of putting out there, recognizing that this is a very important process, or a very important concept that plays a very important role in how we behave in times like this. Then I'm going to talk about the phases and stages of epidemics, and it's important for us to recognize what that is. Then the 5 crucial stages of response. How do we tend to respond to epidemics? So we clearly have the sort of political response, we have a social response, we have an individual response, but we also have a Sharia response, a Sharia response to these concepts. Then this is a kind of a tool, an impact assessment, for Sharia considerations in measuring risk. So how do we measure risk from an Islamic perspective? What are the tools that we can use to ensure that we are applying the hukm shari, our rulings, Islamic rulings, accordingly and appropriately? Then we'll talk through a couple of key practical challenges that we have, not just as Muslims, but generally as a population. I'm going to then talk a bit about the sort of underpinning theological understanding of Islam and epidemics. And then finally, I will finish off with Shari need and necessity, haja and dhurura. which I will talk about in more detail. And then finally, I'll finish up with 3 case studies applying these tools to these 3 case studies. One is about closing down the masjid. I know this is an issue that's been discussed in depth, but the whole point here is to provide some lessons that we can learn from and how we can use this tool to address these kind of concerns. Also, the ghusl of the dead body, and also finally the doctors shaving their beard. So these are sort of things that seem to come up quite a lot, things that I'm getting approached about quite a lot. So on that basis, we will address these kind of concerns. There are many other topics, but that's not the purpose of this session. The purpose of this session is to look at the subject holistically and also to look at how we can apply our principles from the Islamic perspective to these challenges. So let's start off by understanding what are epidemics and what is a pandemic. So an epidemic, in essence, is defined as the widespread occurrence of significantly more cases of an infectious disease in a community or population than expected over a period of time. So an epidemic, in essence, means that there is a recognized infection that seems to be spreading everywhere. There's a wide occurrence of that spread, and it's significant, and it's affecting communities, or it's affecting large populations, and that is an expectation of this over time. So this would be considered as an epidemic. So the word epidemic can be applied to many, many different types of infectious diseases. Then the next thing is, when does it become, or when do we start using the word outbreak? An outbreak is a sudden appearance or an increase in cases of disease in a specific geographical area or a location. So it could be even in a village. You could say there's an outbreak in a village. You could say there's an outbreak in a town. You could say there's an outbreak in a country. In essence, what that really means is you get a peak, sort of sudden escalation or appearance of an infectious disease that seems to be occurring and spreading out within that certain geographical area. Then the next thing is pandemic. So what is a pandemic? And a pandemic is defined by the WHO as the worldwide spread of a new disease. So clearly, one thing is it's a new disease. Number 2, it's worldwide spread. So an influenza pandemic occurs when a new influenza virus emerges and spreads around the world, and most people do not have immunity. So these are some of the conditions. Number 1, we don't have immunity to it. Number 2, it's a new disease. Number 3, it's spread so extensively that it's spread all over the world. So majority of the countries would have it, and that's when WHO would declare it as a pandemic, as they clearly have with COVID-19. So just to give you a bit of history behind this, there's been an estimated 1,500 new pathogens discovered since 1970s. And I'm going to talk a bit about old pathogens and new pathogens in a short while. But since the 1970s, so we're looking at approximately 50 years, we've had approximately 1,500. So this is something that's not new, that we're having new pathogens. Approximately over 70% of them, interestingly, have come from animal origin. So for example, if we look at some of the more common ones, like Ebola virus, in 1976, we also have the HIV virus, okay, in 1983. So this threat from animals seems to be increasing intensively, more so recently than it has ever done before. And a lot of that is put down to some of the farming techniques that we have today, recognizing that we live in a global village, and there's a lot of transportation of cattle, there's a lot of transportation of animals, farming animals, transportation for trade. And as a result of that, what we tend to do, we keep animals very close with humans as well as amongst themselves, and we have very large marketplaces. So we deal at a sort of a global level. So we're dealing in bulk to a very high degree, and for that reason, there is clearly a greater level of risk in transmission of these particular new pathogens. So epidemics this century can spread more widely as a result of this, much more quickly, and they clearly affect a greater number of people than they have done historically, and a lot faster. So we have many transportation mechanisms. We fly from country to country, from one side of the world to the other, and clearly infections can spread quite considerably within a very short period of time, as we have discovered with COVID-19. So they can have a massive impact on the economy, and something that we need to recognize. So they can affect countries, quite intensively, including travel, trade, and lives of people. So on that basis, it's not something we can just brush under the carpet. It's something very serious because it impacts us in every single way. Now, this is quite important for me to mention some of these definitions, also to just give a historical account about the background behind this. What I'm going to do is I'm just going to briefly talk about the types of pathogens. So epidemics usually occur either by one of these two ways. Okay, so they have either re-emerging pathogens. So these are pathogens that are known for some time and they just re-emerge and threaten other populations, or those populations that are not as, where there's no herd immunity, or not immunized against them. So for example, COVID-19, maybe in 2 years' time, you may find that there is another emerging infectious incline of COVID-19 infections within a certain population that's not immunized, or you may have a mutated form, and so that risk will always be there. The question arises how we deal with that. The other thing is about new emerging pathogens. So COVID-19 is a new emerging pathogen, and it comes from, they can come from bacteria, they can come from viruses, they can come from fungi, parasites, and many other sort of types of pathogens. Some are born in contaminated water or food, others are carried in the air we breathe and by human touch. Now, COVID-19 is suspected to have come from bats and through the wet markets in Wuhan in China, and clearly, that's the speculation. And as we can see today, it's spread all over the world and it's become a pandemic. And we're going to just briefly talk a bit about COVID-19 in that sense. But I'm not here specifically to talk about the science to that degree, but we cannot escape the science, because the science is very important. It informs us about how we apply our fiqh, how we apply Islamic law, or our Islamic normative sort of response to such a condition and to such a crisis. Now, before I go there, I think it's very important that I talk a bit about infodemics, and I mentioned this word before. So infodemics, what does the infodemics actually mean? So infodemics is a new term that's been used, and what it means is the rapid spread of information which may be reliable or unreliable and misleading. So infodemics is just knowledge and information that is rapidly spread throughout the world very, very quickly because of the social media platforms that we have, and it can either be reliable, it can be unreliable, or it can be quite misleading. So we have to be very, very careful about this. We can't underestimate the power of infodemics. Now, the spread usually occurs through smartphones, through the social media platforms like WhatsApp, etc. It can go via internet, other communication technologies. You'd be surprised even reputable organizations or reputable media platforms could end up misleading the mass population on the basis of some of the knowledge that they think is informed. Now, this can lead to public panic. Clearly, if there is some strong statements made within those infodemics. So when there are serious infectious or outbreaks and they misconstrue the actual seriousness of the endemic, you can get false information, and that can lead to public panic. So an example of that is, for example, people going out there buying immense amount, stocking up on toilet paper, for example, and various other things, which clearly there's no need for, but yet due to public panic, people are hoarding this in their homes and various other things, and shopping this particular, in this sort of behavioral manner, which is quite damaging to others. So false or misleading information clearly can cost lives. So, and this is something that we need to recognize, that when we have misleading information, even though it seems so innocent that we're passing information from to each other, reality is that certain people act on that information, and when they act on that information, that could be harmful. With one or two people, clearly there's no real harm, but when you're looking at a large population that's behaving, and we find that there's an escalation effect, if you have a reasonable size group, number of people who are behaving or reacting to a certain misleading information, what tends to happen is the other population, the other end of the population, will look at their behavior, would assume it to be the truth, and then they will behave in the same way. So you have an escalation of that kind of panic type behavior. So it can defy trust between people, and this is another very important thing that we need to recognize, and the government, and even between some of the Muslim population and Muslim scholars. So you'll find that there's certain parables of mistrust that tend to occur in times like this are becoming more and more visible in certain groups and certain people. First of all, the mistrust that occurs between the people and their government. So that usually is recognized historically to occur, that the sort of, because especially when government is planning mass sort of strategic policies, especially if the draconian policies like mass social distancing, lockdown and things like that, and people clearly start thinking of all sorts of wonderful theories to try to understand why something like this has happened. It's quite a surprise. It's not something that's natural to us. It's happened overnight. And for those reasons, people are very suspicious. So especially when the government has control of the matter, and those leading authorities always are seen in a suspicious light. So that's something that tends to happen. And that has a very serious impact on governmental strategies and the way the government has clearly used scientific knowledge to actually go out and do their work to mitigate the circumstances. Now, that's one group of people. The other group of people is something that we haven't actually experienced as much now, but it's likely to happen. And that is the mistrust that will end up happening between health professionals who are on the front line and the general population. So this is another area that is going to start happening, and you'll start seeing social media. I've already sort of noticed a few on the WhatsApp group that are getting sent around about certain personal experience individuals have had of healthcare professionals on front line, and they start sort of sending out these negative messages, and that causes some kind of rivalry or some kind of conflict between medical staff, and that really doesn't help the situation, again, because you have some genuine people out there on the front line who are doing some immense work, and they are seen in a light which is not truly reflective of their behavior, or nor is it of their intention. So these things you'll start, and things will happen in a situation where you have many deaths, in a situation where clearly things need to change, things are escalating, and it's not something which is precedented in our lifetime. So for that reason, you're going to have quite different types of behavior in how we react. Individuals will behave differently, and individuals are not representative of their organization. And that's something very important to remember. People will reflect on that, especially in a very delicate time where our loved ones are dying. So really wrong message can go out. Another group of people, especially amongst Muslims, is the relationship between the Muslim public and Muslim scholars. So we've had instances like that. For example, the issue regarding the closing down of the masajid. So clearly, certain very authoritative yet very senior Muslim scholars, their names have been sort of disguised in a very sort of negative way, which is not really befitting. And they have clearly gone according to what they have learned and their knowledge and understanding, and apply that. And I'm going to readdress this issue again in more detail when I talk about the guidelines. So clearly you can see the dangers of infodemics. So it's inevitable that people of all kinds of backgrounds, expertise at all levels are going to disagree, because it's an unprecedented time. People are very confused. The level of knowledge we have can be very uncertain. This is, I'm referring to the science here. And for that reason, many different approaches will occur. And you can start seeing draconic interventions being implemented. So clearly people are getting, some people get paranoid with that. Controversial sort of ideas start cropping into people's minds. And as a result of this, you'll start seeing sort of naming, pocketing and grouping people in terms of organizations, and sort of talking negatively about individuals is something which is very problematic, and it will happen in times like this. It's important that we don't undermine essential Islamic authorities who hold spiritual well-being in high regard. And I'm going to address this issue later on. Now, spiritual and psychological approaches are a must in any calamity. And this is very, very important. Sometimes we get so bogged down with the science and the social impact of a pandemic or a epidemic that we forget the reality and the essence of what describes and identifies us as Muslims, and that is our spiritual nature, which impacts our psychological nature, which in turn impacts us physically in terms of who we become. So it's very important that we recognize that we have a spiritual and Islamic tradition which is there to support us in times like this. So we must always turn to that. And I'm going to make reference to that in a short while. Now, this diagram, what this is doing is demonstrating the different phases and stages of epidemics. And why is this important? This diagram is important because what it does is it tells us about the stage that we are in. And that's very, very important for us to know. So when we look at the stages of an epidemic, for example, we recognize that the first stage is usually the stage, or stage one, you could say, of emergence. So this is where we have an introduction or emergence of pathogens and disease in a particular community. So that is something that will happen, and we've all experienced that. So we've had the initial emergence. You know, you hear cases like there's 38 cases of detected COVID within a particular nation, and then we hear that it's within our particular city or in our particular town or in our particular state or in our particular county. And then we hear that it's now within our locality. So you can see there's a sense of emergence that we realize and appreciate. Now, recognizing what is considered as reliable information, you know, acting on reliable information, this is the kind of picture that you will see in situations like this. Then you have what we call an outbreak. An outbreak, in essence, like I explained before, is a local transmission. So you start hearing there's an outbreak. And you may find that within the same country, you will have certain places which are more susceptible to this, where there's a greater outbreak. So referring to, for example, the UK, United Kingdom, the England, for example, more to the point, you'll find that, you know, the local outbreak first more than likely has occurred in London and has been quite widespread. So we've been hearing cases of deaths and various other things and people being infected in London quite extensively, and there's been a greater level of stringent conditions about social distancing there than they have elsewhere in England, for example, like, for example, the north of England. But slowly, gradually, recognizing within the next few weeks that you will have that same kind of response, more than likely, in many parts of the world, in many parts of the country as well. So this is the outbreak or locality transmission. Now, the reason why I'm referring to these stages is because fiqh is applied differently in each one of these stages. And that's the important point. I'm going to come to that point in a short while. So then we have the locality outbreak. So this is where you have an outbreak within your locality. Then you have the third phase, which is amplification. And what that actually means is when the outbreak actually begins to amplify. So you will hear cases within your locality, and you'll hear a number of cases, but has it actually reached amplification? And amplification is amplified into an epidemic or pandemic to the degree that the pathogen is able to transmit from human to human and cause a sustained outbreak in the community, and it's threatening to spread beyond it. So in other words, when it's localized to one particular community, it's an outbreak. When it starts transmitting outside that community and it's no longer within control, then that becomes what we call the sense of amplification. Now, amplification is quite concerning because, well, they all are in essence. Even outbreak is quite concerning, but amplification is quite concerning because that's demonstrating that this is going out of control and the control measures that are being implemented are not as effective as they should be. Then the fourth phase, so amplification occurs and becomes a pandemic, extends everywhere. So you could argue and say that as we stand today, we are in the amplification stage. So here you'll find that different nations, different countries have a different rate of amplification relative to other countries. Different localities and regions within those countries have a different rate of amplification relative to other regions or cities within that particular country. So the fourth stage is what we call the reduced transmission stage. So this is a stage that people are hoping to achieve, hopefully, inshallah, very shortly. And this is when human-to-human transmission of the pathogen decreases. And this is because of acquired population immunity or herd immunity, where effective interventions are controlling the disease. So you hear people talking about the curve, and the idea is to flatten the curve. And the idea behind flattening the curve is that when you try to flatten a curve, what you're doing is you're extending it over a long period of time when you flatten it. So you're flattening the peak of the curve. And the reason why it's so important that we do that is because there is a certain level of demand that is an outcome of that particular peak curve. So if you start having a number of deaths all occurring at the same time, then we won't have the capacity, the health services will not have the capacity to deal with this, and as a result of that, you'll have a lot more avoidable deaths. So there are unavoidable deaths, which are clearly deaths from vulnerable individuals who have infection. It's clearly impacted them. We've tried everything we can, and unfortunately it's all been futile, and these individuals unfortunately die. But there are also avoidable deaths, and avoidable deaths may be related to COVID-19, and the concerning thing is a lot of the time they can even have nothing to do with COVID-19, but it could be a disease condition, and because all frontline services are completely in their peak and are full demand, and clearly they've escalated considerably, we cannot care for those individuals clearly that have died, and they were avoidable deaths. And that is one of the biggest concerns. So when you flatten this curve to extend the time so that services can deal and that there's capacity to deal with these, the problem with that is clearly you get a prolonged sense of amplification over a long period of time, and herd immunity takes a lot longer to achieve. So that is the negative aspects of it, but yet the positives in it are the fact that we actually reduce the number of deaths and avoidable deaths as well. Okay, so moving on, we've got 5 crucial stages of response. So, okay, we've talked about the phases and stages of epidemics, but at the same time, there's a way we respond to this, and the response is very, very important to understand as well. So, for example, we have what we call the anticipation stage, or the anticipation phase. And in the anticipation phase, we have the first sort of stage of a pandemic. So in this stage, what you have is you have an introduction or an emergence of pathogens. Okay, now, and they can't be predicted. We know very little about them because they're only scattered in certain populations, and there's very little outcomes that we can measure. But we can anticipate that this could be threatening, and you'll hear cases of that in China, and then the rest of the world was anticipating that this could be spreading. It's not being contained there. So, and the anticipation of risks enables us to focus more on the likely threats of this. So we can only use historical knowledge to address the concern. Because of these low levels of certainty, there are questions that arise, and the questions that tend to arise is whether certain measures can be employed, which are contrary to Islamic rulings. So the question arises when we have anticipation, and clearly we're not feeling the threat in any significant way within our locality, within our region, then can we turn to our fiqh and apply some of those strong rulings which prevent such spread? And the answer to that is it will be focused on the level of certainty of knowledge that we have. So this is the first aspect of it. So this is about anticipation. Then you have what we call early detection. And early detection is where we have an emerging disease. And this is, again, we have a little scientific knowledge about it. It's an emerging disease. We're in early detection phase. So this requires a lot of investigation into the source, and it also requires a coordinated rapid containment measure. Regardless of the severity of it and how much we know, we act at that stage to some degree to contain it, so that at least if it's quite severe, we have already contained it, but if not, then that's problematic. And now you can already hear and see that a lot of people are turning their heads towards China and blaming China on the basis that, even when it was in its early detection phase, that, there was some dishonesty about some of their figures in terms of the level of widespreadness and the seriousness of this infection. So then you have the containment phase. So the containment phase is the effective and rapid containment of emerging disease. And this is vital as early detection in order to avoid large-scale epidemics. So we tend to contain, and you'll find that different methods of containment are usually imposed by different countries. So they all have different strategies in how they do this. So this is when more is known, usually. Containment phase is usually we know more, and there is knowledge of whether it is airborne, through contact, or through other sources. So that is a kind of a more advanced stage. We know more about the disease condition, and hence we know how to contain it. If we don't know anything about it, we act in a more strict way if there is a fear, and we can only use historical knowledge to address that. But later on, what tends to happen is we can gain more knowledge, and as a result of recognizing the routes of transmission, and on that basis we can contain and use many different approaches, such as hygiene measures, washing your hands regularly, and various other things like that. Now, so here, looking at the Shari concessions and commitments here, then this can apply. So some of the areas of complexity will be to decide how the Sharia relates to individuals, how the Sharia relates to localities, how the Sharia relates to regions, how the Sharia relates to nations. So you can already recognize that, okay, we all may have a recognition of the anticipation phase, we all have a recognition of the early detection phase, but each one of us, in terms of the country that we're from, the country that we're in, our government strategy determines the level of containment that is out there. So the government of our country, or the administration of our country, will have certain strategies that they will employ, and hopefully that is informed through good science. Now, if there's a risk of harm to wider society and this harm cannot be contained, or there is difficulty or hardship, so we call this concept the mushaqqa, there is hardship, then the rules of need can be employed. Now, I'm going to make reference to the rules of need and necessity in a short while, but I'm just going to highlight some very important things in terms of applying the rules of need and necessity. Now, necessity is allows us to make those things that are normally considered as haram as permissible, and need, what that does, it mitigates or reduces or eases issues which are normally considered as disliked or haram to a certain degree, so that it becomes easy upon us to behave in those kind of circumstances. And it's all to do with the idea لا يكلف الله نفسا إلا وسعها. No one is challenged to the degree that they cannot bear. On that sense, that we have this ruling in Islam that allows us to enact certain things that are considered as fundamentals of our deen, or the sha'air of Allah subhanahu wa ta'ala, sha'air of Islam. It's like our masajid closing down and various other things. And I'll make reference to that in a short while. Then you have the fourth stage, which is control and mitigation. So once the infectious disease threat reaches an epidemic or pandemic level, the goal of the response is to mitigate its impact and reduce the incidence. So here what we're doing now is, in essence what we're doing is we are sort of minimizing the harm. So here it's about looking at the incidence of the disease, morbidity, mortality. So we could say that at the moment, anyway, in the UK, we're in the control and mitigation phase. So this is about reduction, harm reduction, as much as possible. We recognize that there's going to be harm. We acknowledge that. We don't deny it. We don't brush it under the carpet. We recognize that, but now we work along that and reduce as much harm as possible. So you will find here, as a result, you'll see disruptions to the economy of a country, the political sort of agendas of a country, the social systems will all be impacted at this stage. So you have wider implications as a result of this. And wider implications usually relate to additional hardship, additional mushaqqa. So it's not just a hardship of an infectious disease passing around everywhere, but rather you will have impact on the poverty levels of a nation. You can have impact on many, many different issues, such as the psychological state, the way services are being delivered. So it ensues and advances to higher hardships. And this can have a direct or indirect impact on mortality rates, death rates. Okay, so that's why it's important to recognize that control and mitigation phase is a very serious phase, because it burdens systems and causes increased exponential hardships for individuals. So you'll find that governments will mitigate those hardships. Like, for example, you have tax reductions, you have certain benefits that they are given to those who are out of work because of social distancing, and various other things. Now, the idea is herd immunity would require even those who have not contracted the infection to be immunized. So there's a real search for immunizations at this particular stage. So you find that immunization schemes become a very important part of control and mitigation. The question now arises, depending on the seriousness, some of these immunizations may contain haram ingredients. So where does the Sharia stand in regards to that? So these kind of discussions haven't even occurred yet, but generally speaking, these are things that we need to consider. So then you have the elimination or eradication phase. And the elimination eradication phase is where we have control of a disease. So this can lead to its elimination, which means that it's sufficiently controlled to prevent an epidemic from occurring in a defined sort of geographical area. So the disease is no longer considered a major public health issue now, okay? However, there are interventions that still need to remain because there is the possibility of a re-emergence of that particular condition. And we've all heard about this. So at what stage would the rules of need and necessity and hardship apply from the Sharia perspective? How far does it go? So for example, when do we decide that we can open our masajid? Are we going to go with the sort of a governmental strategic agenda? But if we were to open the masajid, let's say tomorrow, can you imagine suddenly you're going to get a number of people who will be reading? There's a thirst for the masajid, clearly. So you'll find a number of people, going to the masajid, even people who normally never did before, and that could be a potential risk. So these are kind of considerations that we will be talking about very soon. So we need to think ahead, and when we think ahead, we need to think and projectile understanding of terms of some of the fiqh issues that are going to occur in the very near future that haven't already been addressed. Okay, now the next thing I'm going to do is I'm going to align fiqh concepts to these stages. So if you remember from this chart, I talked about the first phase, which is the emergence phase. I talked about the second phase, which is the outbreak or localized transmission phase. I talked about the third phase, which is the amplification phase. And I talked about the fourth phase, which is the reduced transmission phase. So then the stages of responses, as I mentioned. So usually in the first phase or the emergence phase, we have what we call anticipation and we have early detection. Usually in the outbreak or localized transmission stage or phase, we have a response which is usually containment. Then we have the third phase. So majority of the parts of the world at the moment, especially Europe and America, North America, various other places like that, we're in the third phase. So we're in amplification and we're in the early stage of amplification. So here, the kind of things that you'll find is we're in the sort of containment and the control and mitigation phase, okay? So here you'll find, then finally we'll have a phase, the fourth phase, which is the reduced transmission phase, and this will be elimination or eradication. So there will be certain Sharia rulings which will apply. So going back to the concept of need and necessity, as I briefly described earlier, I'm going to talk about it in more detail later on. You will see that rulings of need and necessity may just be limited to individuals or localities when there is just the first phase, so anticipation and early detection. You will see that rulings of need and necessity may just be limited to localities where there are outbreaks in particular and not other localities, unless there's a certain heavy risk that's recognized. In the third phase, which is the phase that we're in now, you'll find that rules of need and necessity may apply to all where there are outbreaks and beyond. Recognizing, number one, that you're looking at initially referring to individuals, then you're referring to neighborhoods, you may be referring to localities, you'll be referring to regions, you'll be referring to countries, and then you'll be referring to the whole world. So when we have certain fatwa that are coming from North America, and we have certain fatwa that are coming from South Africa, and we have certain fatwa that are coming from India, and they're all coming at different times, some have a response which is more stringent relative to other responses, you can already see the amount of confusion that's going to cause. So let's say, for example, being in the UK, you're receiving through WhatsApp messages or whatever, fatwa that are from Indian Pak subcontinent, for example, the scholars there, and you're thinking to yourself, oh, well, clearly the rules are not so stringent here, and these are what we're applying. So on that basis, it's very, very important that the local Muslim scholars address the concerns of their locality. That is absolutely essential. And that isn't to say that they can learn from the fatwa that are passed around different states. So you can already see that there's different stages of this particular epidemic, as I've outlined, from first phase to the fourth phase. And it's worthwhile looking ahead and looking at some of the fatwa that are clearly been developed and issued in many parts of the world, which are ahead of us, okay? And realizing how they're dealing with it, what strategies they have in place. So in the similar way that people are looking at the science and how it's applying and the strategies that each government is holding to or employing in different regions of the world, similarly, it's important for us to recognize the fatwa that are out there and how much of an impact it's happening. And the impact that we look at is not just in the sense of what is written in the fatwa, but we also need to look at how is the Muslim population responding to that. Is the response something which is compliant? Is the response causing panic? Is the response? And these are very, very important lessons that we need to learn, even when we look at the concept of passing fatwa or issuing fatwa. Okay, now I'm going to make a reference to that. So this final phase about elimination or eradication, we look at rules of need and necessity may continue and actually extend well into this phase until there is assurance that safety can be maintained. So what you'll find is you'll have a sense of herd immunity to some degree, but yet there are still populations or groups of people within that sort of region who still are at risk. And at that particular time, the strategy may be that though we still remain with our social distancing. So this is very important. And you also have to recognize that governmental response all relates to thresholds. So they measure the harms and benefits. So clearly recognizing that early social distancing has a massive impact in terms of the economy. It has massive impact in terms of psychology and the panic status and various other things, and it can be very costly and so forth. And for that reason, they mitigate it to as much as they possibly can. And as a result of that, each nation has its own particular strategy how they deal with it. Sharia is different in the sense that it doesn't just respond to the government. Sharia has to have its own recognition. It needs to recognize these phases, and it needs to know at what time it needs to enact its rulings of need and necessity. So this is an outline, a kind of a tool of, just a general guideline on roughly at what stage, what rulings would be implemented and to what degree. And this is very, very important. So even though the strategy of our government may be late, and unfortunately, people have sort of hung on to that. But that isn't to say that we as Muslims should have our own understanding about when we make decisions about when do we close our, not necessarily close our masajid down, but we limit the number of people attending our masajid, or even closing them down, and various other rulings. Okay, so that's the main point to take from this. The next thing is impact assessment, the Shari considerations in measuring risk. So when we look at Shari assessments or considerations in measuring risks, there are in essence three particular areas that we need to think about. First of all, we need to first think about the characteristics of the pathogen. So what are the characteristics of the pathogen? That's an essential part of this, because that gives us some kind of information about the seriousness of the pathogen. So this refers to how well it spreads between people, and it's what we call its virulence, okay? And that's very important here. The second thing we need to look at is the severity of the resulting illness. So, okay, there's a pathogen, its transmission rate is immense. They usually describe it as the attack rate. Its attack rate is very high, but is it a severe illness? Do we get severe illnesses? So the severity of the resulting illness is important. We need to look at mortality figures, how many people are dying, morbidity figures, how many people are becoming quite disabled by this virus, for example, and the rates as a direct result of those infected. So we need to look at it from that particular perspective. The third is ability to control the impact. So the ability to control the impact is another very important part here. And that sort of refers to the medical or other measures available to control the impact of the virus and their effectiveness. So for example, if vaccines come out, when will they come out? And how effective will they be? If there are certain medications, have we discovered any kind of treatment for this? How effective it is? And also, impact can also be very dependent on compliance of the population. So if you have a population that's skeptical of the government, their response is such that they are quite blasé about it, the information's not strong enough that has that level of impact, you can get a non-compliant population, and therefore that suggests that your ability to control the impact is very poor. So our Sharia considerations should take these three things into consideration. The first is the characteristics of the pathogen, what is the transmission rate, how far is it spreading, how quickly is it spreading. We should take into consideration the severity of the resulting illness, and when people are infected, how serious is that illness? Is it causing deaths? To what degree, what percentage relative to other infectious diseases historically? And then finally, our ability to control the impact, which is a multi faceted discussion in terms of its impact on economy, its impact on the health services, its impact in terms of compliance of people. If people are not complying, then clearly that's going to cause a lot more demand and a lot more deaths. Taking these three things into consideration, the other thing that we need to understand is transmission. So these are the things that we talk about. So how do we measure these three areas? So looking back at these areas, so characteristics of the pathogen is normally measured on the basis of its transmission rate. Severity of the resulting illness will be measured according to the morbidity and mortality, and ability to control impact will be measured on the basis of the burden or the impact on the health systems. So on that basis, these are three very important concepts that we need to take into consideration. So what you're left with, in essence, as a result of that, is you have transmission, you've got morbidity, mortality that you're measuring, you're looking at the impact on the health systems as a result of it. Recognizing all these three very, very important issues, then we can look at how we apply our concepts of need and necessity from the Sharia perspective. Now, I'm not going to go into too much detail here, but these are just very important factors that we need to take into consideration when we apply the rulings of Haja and Darura, need and necessity. So I'm just going to briefly outline what they may be. So here, for example, speed. So if we look at speed, and this is referring to speed of transmission. So in local areas, the number of cases and demand for services can be expected to develop with great pace. So you need an agile and coordinated response. If that's not happening, then you clearly are going to face problems. So there's a question of capacity needs are not being met and so forth. So these are hospital care, community nurses services. This can cause difficulties ensuring everyone impacted receives the right care at the right time. So you can end up having what we talked about earlier on about avoidable deaths as a result, if the speed of transmission is fast. Now, COVID-19, we recognize that it spreads, its transmission rate and its attack rate is very high relative to other infectious diseases, and hence you're seeing the kind of response that we're getting at the moment. So the infectious hazard is its severity, its lethality, its modes of transmission, and how it can be diagnosed, treated, and managed. These are things that you would take into consideration there. You have what we call local hotspots. And what that really means is the demands of the pandemic are unlikely to be uniform. So what you have is you get different areas with under pressure at different times. And that causes a lot of confusion in terms of why are people reacting much more stringently here relative to another place. So that can cause a lot of confusion amongst people. And hence you can get quite worked up about generalized fatwa, which can prove quite problematic for some individuals because they don't address the cause of the public anxiety. Sometimes they don't address the issue of causing panic and disorder, and they don't address issues of non-compliance. So for that reason, they can be taken in the wrong way. So the other thing is about geography of the outbreak, and I mentioned that before, recognizing that different geographies require different level or threshold of fiqh application. Then there's something about severe morbidity, mortality. So you have a sense of uncertainty. So uncertainty is a very important thing. So there's little or no information about the outset of new pandemics, about the severity of illness. An example of that would be, for example, the deceased. Now, when we have the deceased, there have been fatwa saying that you can do tayammum, you can do wiping, you can do tayammum, dry ablution, you can do masa. You don't need to do ghusl in this instance. Then there are other fatwa that came out. There is no, we need to go back. And the reason why that is because there was a level of uncertainty about the intensity of transmission from dead bodies. So new science will evolve and tell us more, and hence we can be more informed about how we write our fiqh. Then there's something about profile. The media, public and professional appetite for information is likely to be intense at certain times. So you'll find that that requires frequent, consistent, coordinated communication. And this is the time when misinformation, conspiracies and things like that can happen. So you'll find that many people are relating the issues of 5G to the whole idea of this pandemic, to what degree and so forth. I'm sure that you're all informed about that. And there's also something about duration. So pandemic wave can be expected to continue for many weeks. It can continue for many months even. So these are inevitabilities, these are trends. So the fatwa need to be successive, calculated, and relate to the interim periods, recognizing the different stages and different phases of the development. That's important because the trust is essential. So if people start mistrusting, and this is something that we started seeing, especially with the issue of the masajid, there's a certain level of trust, especially amongst the medical community and with the ulama, Muslim scholars who were issuing fatwa in terms of closing down masajid, for example. That was one good example, and also using social spaces and the issue of social distancing and hygiene measures that are not being implemented in certain places of worship. So on that basis, you could already see that there was a lot of tension there. And I've never seen this before in my life, where the leadership amongst Muslim doctors, physicians, clinicians was quite exponential. These individuals, I've never seen so many engage with the ulama like I have done, in this sort of period of time. It's been quite amazing. So there's some real positives in terms of the engagement that's been going on between different groups of people. So level of trust is very, very important, and that needs to be addressed in any kind of issues related to fiqh. There are also recognizing people's underlying beliefs. So there are certain cultures we have, certain traditions, certain values and certain practices. Muslims belong to different sects, schools of thought, different spiritual leadership affiliation. So for that reason, we will follow our authoritative figures in Islam, and we will neglect others. So for that reason, you will see there is a mix. So you can't always expect everybody to employ a fatwa that's written by a group of people with a certain affiliation. So you will find differences occurring. That adds to the complexity. So, I'm just explaining the difficulty that can arise in these kind of circumstances. There's also something about education levels of awareness. So understanding the level of information, being able to comprehend that, really absorb that, realize the seriousness of that can sometimes vary amongst different groups of people, especially when you've not been exposed to that kind of level of information or presented in that particular way. And one thing that you do find is and I've been sitting in groups where I've sat in groups where we've had senior Muslim scholars, and we've had sort of young clinicians and doctors who are trying to explain their frustration to senior Muslim scholars. And the interesting thing there is what you find is that they tend to frame their their understanding to the scholars in a certain way to address a certain issue or a certain outcome. Now that causes problems sometimes because some of those Muslim scholars recognize that it's being framed in a certain way, and for that reason that level of trust in the level of truth in that knowledge that that clinician is telling them is sometimes problematic, and it's sometimes not completely trusted. So that's why it's very, very important that public bodies are involved, and individual doctors and people like that should not just think that if I approach as an individual that will have an impact. It will normally not. Rather, it needs to be a public body response, or you're getting people of expert opinion who are addressing this concern generally. So these are sort of some of the factors that sort of we can discuss in relation to this. There's something about wider application or applicability, and that really responds. So the response to, for example, H1N1 influenza pandemic was built on and enhanced the response to more routine pressures, such as those arising from severe weather. So here you see that there was a different sort of rate of transmission there at that time. So these are the factors should also be considered. So does weather impact it more, and so forth. So there are these kind of considerations, but we can only leave them to the experts. They're the ones who will be informing us. We can't sort of take them in a skeptical sort of way, because reality is skepticism doesn't really happen. So what we're doing is we're taking knowledge which is mawhum, conspiracies, and we're using that as an approach, rather than going by what we consider as ghalabatul dhann, which is predominant presumption, which is what Islam allows us to take, and we can use that as hukm shar'i, as rulings. We can apply it. So we can't apply Islamic rulings on skeptic concepts and ideas. Okay, it can only be applied to the more certain the knowledge, then we can go by that. So if public bodies are telling us something, regardless of whether later on we discover them to be incorrect, as long as we've applied it to that information appropriately, then we are not held liable, but rather then and that's how every profession works. But if we start applying Shari concepts to mawhum issues, mawhum meaning elusive issues, like certain theories and conspiracy ideas, that is something which is blameworthy. It's problematic because you're applying it to things that are not certain. Okay, now this particular task or this particular tool is quite useful for you to think about. I'm realizing I'm running out of time, so I'm going to be a bit quick here. But what this does is it's a tool that I've sort of put together with one or two other people. And generally speaking, what it does is it explains these sort of serious stages. So virulence, seriousness of outcome, impact, accuracy of information, and compliance. So when we talk about virulence, we're looking at the transmission rate. When we're talking about the seriousness of the outcome, we're looking at the morbidity and mortality rates. When we're looking at the impact, we're looking at the impact on services. When we're looking at accuracy, we're looking at certainty of information. How accurate is that information? Are we very early on? We're not very accurate about that information. Can we take it seriously? So forth. Compliance, we look at the uptake of advice. So are people accepting that advice? Is there compliance? Okay. So we can grade it accordingly. So this is, at the moment we don't have anything. So this is something at least. So we grade it accordingly. So if the transmission rate is slow, we can, potentially score it at 1. If the morbidity mortality rate is low, if low impact, then you have low, moderate, and serious. And you can see already impact on services, low impact, moderate impact, high impact, and certainty of information is uncertain, moderate certainty, certainty. Uptake of advice is good compliance, moderate compliance, poor compliance. So you can see that if you are in a situation where the transmission rate is serious, like the COVID-19, then you're scoring 3 there. The morbidity mortality rates are high, you're scoring there. Impact on services are high, you're scoring there. Certainty of information is high or moderate certainty even, you're scoring in those 2 columns. Uptake of advice is moderate compliance or poor compliance. And you will find that usually in sort of BAME communities, so Black ethnic minority communities or immigrant communities, that compliance tends to be the lowest, unfortunately. So this is where you have the greatest level of concern. So you may be able to apply a higher level of stringency in the rulings from an Islamic perspective in areas where there's a lesser compliance. So even though you find that in areas where you think that the people there are not taking heed of rulings related to the closure of masajid, for example, then ulama can stand up and apply more stringent conditions to ensure that there is greater level of compliance. So scoring this up, this is a sort of brief sort of outline of scores. So COVID-19 falls into 10 to 15. So it's clearly a serious threat. And when there is a serious threat, then there are some serious things that we need to take into consideration in applying the concept of necessity and need. Now this slide is a bit heavy, but generally speaking, it outlines some very important things, key practical challenges and advice that we should take in epidemics that require intense engagement with the communities. So the first thing is detecting an outbreak, for example. So when we're looking at detecting an outbreak and detection of newly infected people, so we're looking at case detection, contact tracing, willingness of the community to support the process. This is an important thing that we need to look at. What is the compliance and detection rate? At the moment, the problem is that we don't have enough tests for COVID-19. So that it's become more an issue that we're not getting the supply of tests. The second thing here is minimizing harmful practices. So at the individual and community level as well. So this can increase susceptibility and exposure. So for example, adopting protective practices such as medical and non-medical practices, like regular hand washing, sneezing into handkerchief and things like that, isolating oneself from the main public and things like that. So that's an important issue. The third important issue is seeking and providing healthcare as advised in the household, community and health facility. So following up to date instructions from government and public health, how compliant is the population to that? The fourth is reintegrating of survivors back into the community. So you may have people who have infected. Sometimes there is certain stigma towards them and they are treated in a certain way. Alhamdulillah, I think this in this particular epidemic or pandemic, we've not had that much of an issue there. Clearly, we recognize these individuals. Alhamdulillah, many of the communities are really helping and supporting these individuals. But historically, when there have been pandemics, these kind of individuals like HIV, for example, Ebola virus, people are becoming stigmatized on the basis of the fact they've been infected. Next is identifying and managing misinformation and rumors. This can cause public panic and indirectly impact good work that is happening already. So that's important. These are things that we need to take into consideration because they can vary from time to time and they impact this whole tool in terms of its effectiveness. Okay, now Islamic approach to epidemics and pandemics. Now, one thing that we have to recognize in Islam, and I'm not going to go into the sources, but just give you a very brief outline, is that you will see here what we have is we call the asbab al-zahiri. So these are physical means that we use to reduce infection rates and also to, like I said before, to lower the curve, to sort of prevent it from peaking early. So on that basis, social distancing, self-isolation, repeated hand washing, using certain protective wear, all these things are physical means, and they are usually informed through science. Okay, the more accurate the science, the more updated the science, the more we can take this up. Now, in Islam, you'll see a very, very important part of this is what we have the asbab batini. So we have the physical means or the means which are clearly identified through the science, but we have the asbab batini, which are essential components to our theology, and that is spiritual means. So I'm not going to go into the details, but generally speaking, Allah subhanahu wa ta'ala produces epidemics and pandemics for a purpose. There is always a purpose behind epidemics and pandemics. And usually, and if not virtually all the time, when Allah subhanahu wa ta'ala produces and brings about epidemics and pandemics, it can be a form of punishment, and it can be a form of mercy as well. So it may be a punishment for some people, and it may be a mercy for others. And this is something that the theological literature is abundant in, and it's very clear on this issue. So on that basis, the whole point of this is that Allah subhanahu wa ta'ala makes us of those where it becomes a mercy for us, not a punishment. And one way that we recognize whether this is a mercy upon me or whether it's a punishment upon me, whether it's a rahmah or whether it's a adhab, is you need to look at your actions. How are you behaving? Are you turning to Allah subhanahu wa ta'ala? Are you turning to the prayer mat? Are you becoming more conscious of Allah subhanahu wa ta'ala and His deen? Are you practicing more? Are you behaving righteously towards other people? These kind of behaviors are in essence demonstrating outwardly and inwardly whether this epidemic is a mercy upon you or it's a punishment upon you. If you are turning away from Allah, you're being so infatuated with the physical means and getting frustrated, and you're moving away from being conscious of Allah, from those things that connect with Allah subhanahu wa ta'ala. You're not repenting, you're not asking for forgiveness. These kind of things are generally demonstrating that this epidemic is becoming a punishment for you. So, na'udhu billah, we need to protect ourselves from this and recognize that we need to respond in a certain way. Now, for this reason, you find that even the fiqh literature addresses these very important concerns. So the fiqh literature doesn't just look at the asbab zahiri, but more importantly, they look at the asbab batini, because at the end of the day, I can shift this cogwheel as much as I like. It's not going to make, it's going to get trapped. If this cogwheel is rigid and it's not moving, I can move this as much as I want in this anti-clockwise direction. It will not move this, and as a result of that, it will not produce a good outcome. However, if I fulfill the movement of the asbab batini and I shift this, at the same time, the physical means are shifted as well. So we use both means, and you will see that the good outcome will occur. So as our theology, our Islam teaches us that we must embody the asbab batini, the spiritual means. We must turn to Allah subhanahu wa ta'ala, because at the end of the day, this is all Allah's doing. And as a result of that, He is the one who will relieve us of this burden. And as a result of this, the asbab zahiri will also be recommended. So the fiqh applies to both. The fiqh applies to the spiritual response, and the fiqh applies to the physical response. So for that reason, how we behave outwardly in terms of our limbs and how we behave inwardly in terms of our heart are both things that the fiqh should address. So the fiqh, in essence, talks about a couple of things. Before I go there, there's a question with respect to asbab zahiri. In addition to physical means, like hand washing, would it be safe to suggest that there needs to be immunosupportive means play an important part in life preservation? Yeah, all forms of, if there's science behind it, then alhamdulillah. You know, at the end of the day, it's very important that even the fiqh literature and fatwa, they need to be very conscious of what the science is saying. We can't just assume that certain things are beneficial. Either it's something that clearly has been mentioned in the Nas, so in Quran and Hadith, or it is something that clearly science is telling us these are the asbab that are physical means that we use. Now remember, even things like, for example, black seed oil and various things like that, at the end of the day, it's all to do with yaqeen. If you have yaqeen in Allah subhanahu wa ta'ala, then Allah subhanahu wa ta'ala will produce a cure in those things, inshaAllah ta'ala. Now, looking at this idea of the maqasid al-sharia, the higher objectives of the sharia, you will recognize here that there are certain things that our deen preserves. So if you were to extrapolate some of the different chapters of fiqh, and we recognize certain patterns in each one of those chapters, we form what we call maxims, bring them together, and we form that they are preserving certain things. We form what we call maxims or qawaid or kulliyat, and those qawaid or kulliyat relate back, and from those maxims we recognize there are certain things that our deen is preserving, the maqasid al-sharia. So we have, for example, we have scholars like Imam Ghazali in his Mustasfa, Imam Shatibi in his Muwafaqat, and various other scholars historically who have recognized that there are 5 main things that our deen is preserving: the preservation of our deen, hifz-ud-deen, the preservation of our life, hifz-un-nafs, the preservation of our mind, hifz-ul-aql, the preservation of our lineage, our families, hifz-ul-nasl, and the preservation of our wealth, hifz-ul-mal. And these 5 things must be preserved. They are absolute fundamentals in our deen, no matter what the situation. When it comes to pandemics or epidemic, these are the things that the rules of need and necessity will apply to. So it's our deen must be preserved. So you'll find that certain scholars have a larger emphasis on preserving deen, and they give more moral account to deen, more than even life to some degree in certain instances. And this is all a balance that is absolutely essential, because at the end of the day, preserving our family, preserving our mind. So if we are psychologically impacted to that degree that there's, that we're not comprehending, we're having a serious amount of mental illness, it's impacting our lineage, our families, our children, it's impacting our wealth to that degree, all these things need to be considered. So our fiqh needs to approach all these important areas. Now, I'm not going to spend too much time on this because there's a lot of work I've done on this. And inshallah, there will be a paper that will be coming out soon related to this. But there is a definition of darura. I'm just going to very briefly outline this. So darura is reaching such a state of extremity that if one did not take up the prohibited means, then one would either perish or become close to perishing. So this is how serious darura is. Imam Shatibi gives a more broader understanding of it. So he says that it's the need to preserve the good interests of life, of hereafter, and life of this world. So if it's not met, then the good interests of the life of this world will no longer remain, but they will diminish, and there will be disorder, loss of life, and it'll preserve those 5 things that I talked about earlier on. Then we have definition of haja, need. So this is a lower sort of sense of rulings. So haja, technically defined, it refers to, in essence, Imam Shafi'i defines haja as the expansion of measures in cases of need, or leniency, in other words, in cases of need, in order to relieve serious difficulty from that which is harmful, to that of ease, where the hardship is diminished with that which is sought. So Imam Suyuti further elucidates that this is a state when a starving person is in need of food and he is unable to find that which he can eat. So he does not perish from not eating, but he suffers difficulty and hardship. So the ruling of this state that it does not permit the prohibited. So here you can see that haja is a different paradigm. So looking back the Shari guidelines here, there's a couple of things that are important. The first thing is, number one, the epidemic or pandemic illness must not be considered a minor illness. So this is the first condition of applying the rules of necessity. So mild illness would be considered an illness with mild symptoms which are unlikely to exacerbate and not treated. So the effectiveness of the intervention must be recognized and evidenced by public health bodies. So in other words, predominant conjecture is ghalabat al-dhann, which is approximately 75% and above, is justified as effectiveness of an intervention cannot reach level of absolute certainty. So in other words, fiqh will apply when the level of certainty is at the level of ghalabat al-dhann. When there is predominant conjecture or predominant presumption, that is the level where fiqh can be applied appropriately. Anything below that, then you will find that certain instances fiqh can be applied, but we cannot apply the rules of need and necessity to that degree. Okay, so then there are the benefits of the intervention must outweigh its harm. So recognizing there are certain benefits, but it should also outweigh its harms. So if you're going to do things like close down masajid and things like that, we need that harm must be eliminated. There are certain maxims that we use. There must be no harm or reciprocating harm by doing that. So you'll find some people say that, okay, there is a spiritual harm. Clearly the essence during this time is that we should be turning to Allah. If we empty our masajid, then how are we going to turn to Allah subhanahu wa ta'ala, as a population, and that could be harmful. So they look at spiritual benefits, and then there are physical harms due to the illnesses, due to the virus. Then there are other things such as a greater harm is eliminated by tolerating lesser harm. Harm must not be eliminated by equal harm. So أَضُرُّ لَا يُزَالُ بِمِثْلِهِ يُخْتَارُ أَحْوَنَ الشَّرَّيْنِ, the lesser of the 2 evils to be chosen. So these are certain maxims that are used in addressing these concerns. The other thing is no alternative permitted intervention reasonably available of equal or greater effectiveness. So you cannot just implement rules of need and necessity at will, but rather if there are other alternatives which mitigate the circumstances effectively, then those should be used as a response. However, if there is an element of mushakka, hardship, in using those additional means, the mushaqqatu tajlibul taysir, hardship begets facility. So you can use reasonable, practical. It has to be reasonable, practical in terms of cost effectiveness. If something's too expensive, then Islam will allow that for hardship and will allow you to use these other means that normally are not permitted. And reasonable, practical in terms of local availability in time and place. So for example, certain rulings around using certain PPE, face masks and things like that. So these are sort of some generic issues that we need to take into consideration. And finally, the permissibility of intervention remains as long as the injury remains. So not just confined to past or present, but also for certain future events. So there's a concept of tajriba. So in other words, if we know we have an understanding, and that understanding gives us some level of ghalabat al-dhann, predominant conjecture, predominant presumption that this is going to be the outcome, regardless of the fact that it hasn't happened yet, then we can apply the rulings of even need and necessity then as well. So, but effort should be made to find halal alternatives always. So, الضرر يدفع بقدر الإمكان, harm is to be eliminated within reasonable limits. ما جاز لعذر بطل بزواله, a thing which is permitted out of excuse ceases to be permissible with the disappearance of the excuse. لا ضرر ولا ضرار, there must be no harm reciprocating harm. So this is a checklist in essence. So if you look at this checklist, you will recognize that the checklist is something which sort of puts this in much easier focus for us. So you tick off this checklist. So here's the checklist. The epidemic is an immediate or certain serious threat. Yes, it is. The proposed intervention is effective. So we need to look at whether the intervention we're thinking about, which is clearly normally prohibited or not allowed, or permissible or disliked, whether that intervention is effective. And it has to be at least over 75% for it to be effective. The benefits of the intervention outweigh its harms. There is no other permissible alternative of equal effectiveness. There have been some effort and hardship in finding an alternative solution, and the threat still remains as at this significant level. So these are some of those conditions that are outlined, those 6 conditions highlighted here. So how do we apply this to fiqh cases? So let me talk about closing down the masajid, for example. So here you'll find number 1. Let's apply it here. So number 1, the epidemic is an immediate certain serious threat. Yes, it is. The proposed intervention. The intervention is we close down our masajid. So this is a discussion you'll find amongst Muslim scholars. There's the issue of asbab zahiri, asbab batini, our iman, the fact that it impacts us if we are away from our masajid. Clearly, we have to recognize that our iman is at a much greater state when we are in our masajid than we will be anywhere else. However, that isn't to say that our iman can go up and down on the basis of events and things like that, regardless of whether we are in the masajid or not. So here, these kind of considerations are taken into consideration. The other thing is about the benefits of intervention outweigh its harms. The other is there is no other permissible alternative of equal effectiveness. So one discussion around that occurs around the fact that people are already going to markets, supermarkets, and that is considered as essential. So it's considered as essential. The masajid to some Muslims is essential as well. Just as essential as you going out and having physical food, there is the essential need for you to have spiritual food. For that reason, you'll find that certain masajid were reluctant to close what they consider as too early. They saw people going to the shopping malls in groups, no social distancing. Why are we, implementing this in the masajid where reality out there, it's not happening anyway? So, on that basis, so they saw it from a different kind of perspective, I suppose. So then you look at the concept of there have been some effort. So to reduce impact, there have been some effort and hardship in finding alternate solution. We need to go into the concept of hardship. So for that reason, you'll find that some of the masajid, what they've done is they've said that at least we keep our masajid open. We have 2 to 3 people who do the regular jama'ah there and even read their Salatul Jum'ah. At least the masjid is open, but unfortunately not open to the public because we are damage limitation. So on that basis, these masajid are actually open, but not to the public. So on that sense, you can interpret that whichever way you want. But generally speaking, you see that this is the response by many scholars. Other scholars have decided to close the masajid completely because they feel that there are still going to be harms because people will still not follow the measures, the physical measures to mitigate the circumstances. So reducing mortality versus preserving spirituality has always been an issue with the masajid. So you find small group maintain jama'ah and so forth, and this has been a way of dealing with it. So the threat still remains at this significant level. So when do we start opening our masajid fully? Do we open it to only small groups of people? Later on, what will the fiqh tell us? Will it be larger groups as time goes on? Will we still be doing social distancing even after all this peak is over and done with? These are things that we need to consider in some of the fatwa that are going to go out tomorrow, inshallah. Okay, so the next subject is doing ghusl of the dead body. So here you'll see again, the first part is the epidemic is an immediate certain serious threat. The proposed intervention is effective. So this is important. If we are going to avoid ghusl and we're going to do tayammum or we're going to do masa, etc., is this actually by doing this, is this an effective sort of intervention? Is that really truly damage limitation? Can we mitigate it any other way? Can we use PPE? Can we ensure? So as science informs us more, so we recognize that transmission is only mainly through water droplets, aerolized periods, but the dead body doesn't breathe. So on that basis, it's usually when you're compressing the abdomen, for example, or chest, or moving the body, that there is that possibility that the air can become aerolized with potential pathogens. So on that basis, if you're mitigating it by using certain equipment and certain dressing code, then you're mitigating the circumstances. So on that basis, ghusl can be performed, but we're taking caution. We're not performing a full ghusl. So you try to use as much alternative means as possible, and that's how the Sharia works, in essence. And these things are important. Ghusl is important. It's asbab al-zahiri. We recognize that its effectiveness. There are looking at the asbab zahiri issues, there is a haqq of the person, who's the haqq of the mayyit. They have certain rights, we need to implement them. Effectiveness of the interventions, comparing essentials. Sorry, this is sort of going on talking about the masjid, I apologize. But generally speaking, it sort of talks about issues, for example, mitigation, using the appropriate clothing and wear in those kind of circumstances. Okay, we have a question. Okay, we've got somebody who's got a hand up, so I'll let somebody speak. Okay, I think. Okay, you can speak. Okay, no response. Okay, so doing ghusl of the dead, again, we just mitigate the circumstances, and hence this is the approach there. And finally, doctors shaving beards, and this has been a controversial sort of issue here as well. So number one, we go through this whole scenario. Now, remembering the hukm regarding beard is at the most wajib, yeah? So on that basis, recognizing the hukm of wajib, this is a slide that I filled in complete. I don't know where all this information is. I did save it. So what I'll do is I'll put some of this information again when this presentation goes out, inshallah. But here you'll see that going through this whole idea, the proposed intervention is that we shave the whole beard. So on that basis, there are a number of issues that need to be taken into consideration. So it's about damage limitation, clearly recognizing that certain people are on front line. So you need to exhaust other sort of approaches, because, for some people, it's wajib to have a beard. And for that reason, they have to mitigate the issue. Now, we have fit tests, so certain clinicians are expected to have fit tests if they're using N95 masks, FFP3 masks and so forth, to see if they fit. And sometimes, people who have beards pass those tests. People who are completely clean shaven because of the sort of the shape of the face, they fail those tests. So you need to make it very specific for you, so you can apply the hukm shari'i to the individual rather than a population. So you'll find here that, for example, a fatwa will address this on an individual basis, not as a general fatwa and say, look, everybody's allowed to shave. But rather you'll say that these are the conditions for you to shave, and this is you personalized in this particular situation. So for that reason, you'll see many approaches to this, people saying many different things. But if these things are fulfilled, these conditions are fulfilled, then clearly on that basis, you would be allowed to trim the beard to the degree that it's possible for you to pass the fit test. And remember, not everybody needs the special PPE. And there's a lot of evidence now suggesting that using a surgical mask with an apron and gloves for those doctors who are just dealing with COVID-19 patients and not dealing with aerosolized procedures, they don't need the heavy PPE equipment, and clearly they don't need to shave their beards then. So there's something about that. A majority of the doctors are doing that. So clearly, giving blanket fatwa is dangerous, and therefore it's important that we take this into consideration. So you can already see the diversity of opinions amongst the fuqaha, the ulama, regarding these issues, and therefore it's we've talked about geography, we talked about the different phases. So fatwa will change according to different phases. Fatwa will change according to geography. Fatwa will change according to the thresholds of these different rulings on the darura, which will be informed by the science, which will be informed by the population and the compliance. So all these things have a massive impact on how fatwa are addressed. So all we can do, in essence, is there can never be a fatwa out there which gives immense rulings, direct rulings that you must do this, you must do that, but rather they must be taken as guidelines. So we accept those guidelines and we go along those guidelines, and recognizing that each case may be different. Therefore, we need to approach ulama who are clearly have good knowledge in this area and get their viewpoint on individual cases. So hopefully, inshallah, having said that, I'm just going to briefly summarize. If there's any final questions you can ask, I've gone well over time. So on that basis, just to summarize everything, we need to recognize that fatwa are time-bound and need to be used in context. So we need to contextualize fatwa. So those of us who are recognizing, that there is a fatwa on this, why has the ulama, why have they said this? But recognizing to what context they're applying that fatwa is very important. Number two, not confusing issues of fiqh and seeing diversity as always problematic. So don't get all confused and bogged down. This fiqh is saying that fiqh is saying that. And recognizing there is diversity of opinion. And that's nothing that's new, because these are, in essence, what we call dhanni responses. They're related to the science, related to the circumstances. So there's going to be a slight difference of opinion amongst people, and in terms of what things are of a higher preservation relative to others. So diversity should never be seen as problematic. Rather, if there are conflicting messages, what you should do is you should stick to one group of people and just take their fatwa, people who you trust, you believe there are ulama there who have taqwa, and those are the people that you should follow on that basis. Okay, I have another question. Do you think that disproportionate number of BAME critical patients and deaths we are now seeing, considering the incubation period and duration of illness, is linked to the delay in closing masajid a few weeks ago? I wouldn't say that. There may have been instances in certain localities where, for example, where it was a different stage in the phase, maybe. Okay, so if it was clearly in the sort of escalation phase, and things were clearly, you know that there may have been many people in the masjid who were infected, then in those kind of cases, there's a possibility. But we can't sort of assume that. And that's very, very important. Assumptions are very important things that fiqh cannot apply, nor should we as Muslims rely on just illusory understanding. So if we're assuming it, and that's all it is, then we can't act on that. Rather, we need to be very clear that that is what's actually happening. So if you are very clear and there's a clear population, the issue with BAME communities doesn't necessarily mean it's because you will find that when we talk about BAME communities, we're talking about black and ethnic minorities. They don't have to be Muslim, they could be non-Muslim communities. So on that basis, it's impacting all of them. It's interesting to note that we're finding a lot of Muslim doctors and physicians who are dying because of COVID. And that's a very interesting point to take. And the way I see that, and I may be completely wrong, is that a lot of the frontline staff who are actually taking those risks are actually Muslim physicians. May Allah preserve them, may Allah give them a higher maqam. These are truly our heroes, but they are taking the risk and coming to the front line. It's not like some of them are mitigating themselves by using PPE, but clearly they're putting themselves at risk. And we recognize that proportionately there's a lot more Muslims, and I would say this, on the frontline service than you'll probably find proportionate to the population of Muslims in that community. So this is probably another reason why. So recognizing that fatwa are usually just guidelines and there is a need for simple instructions on application that can only be presented by experts. So we need information from experts for us to apply our fatwa. The other thing is always upholding respect for ulama. This is very, very important. This could be very damaging for our spirituality. Even if we do not agree with the ulama, we can try to convince them as much as possible through the knowledge that we have, but we have to be careful that we're not doing that as an individual. We need to be informed. Okay, the science that we're providing them has to be framed correctly, otherwise they will lose our trust. So for that reason, it's important for us to recognize these very important things. It's about trust as well. So appreciating that diversity exists in all fields of knowledge and contrast here is a blessing. But if you have a problem with that, then stick to a group of people and take their fatwa. Limit extreme emotions and maintain all etiquettes at all times. There are certain adab that we need to accept and we need to follow as Muslims, and we need to stick to them. And these are important parts, because remember, as I mentioned earlier, we don't want this to be adab for us. We want this to be a rahmah from Allah subhanahu wa ta'ala. And inshallah it will be. We have full yaqeen in Allah subhanahu wa ta'ala that Allah subhanahu wa ta'ala will produce something, some real khair in this. Inshallah, we will lose our loved ones, but at the end of the day, there will be many, many benefits that we will attain from this, inshallah. And finally, and more importantly, we must turn to Allah subhanahu wa ta'ala. This is absolutely essential, that we must seek repentance, turn to Allah subhanahu wa ta'ala, that Allah forgives us for our sins, because at the end of the day, this is the real essence of what will change our circumstance, and that is our spiritual state and us turning to Allah subhanahu wa ta'ala. There's another question regarding regards to body bags. Wouldn't opening them to perform ghusl give rise to contagions being released into the air, transmit from hospital to ghusl place, may trigger a lot of movements, so it would be the best to take precautions measure of donning masks like N95. Now there's clear some guidance on this. I'm not going to address this. There's I think there are going to be other sessions that will address the more detail related to this, but there are certain guidance on this issue that suggest that the risk is actually quite minimum, as long as it's more to do with your approach rather than the circumstance, in terms of the fact that when you open body bags, clearly there is a aerolized sort of air there, which contains water droplets, which may contain COVID virus. And for that reason, you need to be cautious. You open gently. And there's a certain approach. There are certain videos out there about how you should do ghusl properly. So those are the sort of interventions that you use. And even if they did, you're mitigating it because you're wearing protective wear. And as far as I understand, the science is telling us that even using surgical masks is sufficient, as long as you're approaching it and the procedure that you're doing is safe and effective. So on that basis, that hopefully that should address that particular concern. I think I had one person raising his hand. So I will allow, I think he's put his name down as UK. So I will allow them to talk. So UK.
Assalamu alaikum, brother. Basically, my question is, I'm a doctor, but I've got a responsibility at home, like children, and my husband is a doctor as well. So he's not very happy for me to go to work, especially when the children are home, and his youngest one is about 2. But I do feel bad in myself that because I'm fully qualified, can help out at this time, but I cannot. Usually I'm self-employed. I work as a local doctor, so I've not signed up any session anyway.
Are you from UK? Sorry.
Sorry.
Where are you from? UK.
I'm in America. Yes.
You're in America.
No, in UK.
You're in UK. Okay, so you're in UK.
So that's what.
Recognizing that we've got people all over the world, you see, on this.
Okay, right. So I was just wondering how Islamically, where do I stand? Because I do have a bit of guilt feeling that
so Islam, it doesn't make it an obligation for you to go to front line. So if you're looking at it from that perspective, but if you mitigate, it's important that you protect yourself. That's essential. So protecting yourself, and I think, like I said, using the science. So the science is reasonably quite certain now in terms of the kind of the way the donning of the face masks and the type of face mask that you need, etc. So if you're doing aerolized sort of procedures. So therefore, you need to take a high level of protection. That's very, very important. And if you're just sorry.
Yeah, sorry. So my question is, because we are both being in a medical field. Yes. So my husband, he's going to work, but he preferred me not to go to work and stay home out with the children. And because they are all at home because of the lockdown and everything. So, but I do feel a guilt feeling. Will I be accountable? Because being a doctor, I still didn't go to work.
Oh, I see. Okay. Now, clearly, because you're at home and the kids are at home, If your kids are sort of dependents, then for that reason, it would make sense for you to stay at home. But it's all about inna amal biniyat. It's about your intention. So if your intention is such, and clearly your intention is that if I had the means, I would have been out there, I would have helped these people, then inshallah, just through your intention, you're getting the reward. So I wouldn't worry about that. But clearly you have certain rights to fulfill and obligations that you need to fulfill in your home. And, clearly you need to be with your children. And they require a mother around them. So for that reason, you're fulfilling two very, very important tasks and obligations of Islam. So inshallah, Allah will reward you immensely for your intentions and also for the things that you're doing, inshallah. Okay, we have, I think, another question. Do you think the disproportionate number of we have another question, critical patients and deaths we are now seeing, considering the incubation period and duration of illness, is linked to the delay in closing masajid a few weeks ago? Same question again. I actually think, my personal take on this is that BAME communities generally have a greater level of morbidities. Okay, so they have, first of all, for somebody who's worked as a commissioner in Bradford, where I work with the majority Muslim community, I find what was clearly evident in sort of majority ethnic communities, ethnic minority communities, especially immigration communities, you find that the comorbidities, the sort of chronic diseases usually tend to be at a higher prevalence, a higher rate relative to other places. So that's the first thing that we need to understand. You also recognize frailty is usually higher in BAME communities relative to other communities. So for that reason, my take on this is that more than likely the reasons why we're seeing a disproportionate number of deaths in BAME communities is because of the fact that we are more vulnerable. Not necessarily because we're not socially distancing ourselves. You go to Eastern European communities, you see very little social distancing in some of the communities. You go to other non-Muslim communities, you see the same thing there. Non-BAME communities, you see the same thing there to some degree anyway. So patterns of populations are generally not much different. The other risk with BAME communities, probably more so with Muslim communities and South Asian communities, is that we are much more close-knit as larger homes. We got more extended families, and that could be another possibility for the reason why there's greater incidences and more deaths. So these are things that I would probably take into consideration. I think there's somebody else who wanted to ask a question, so I'll allow them to ask if somebody raises their hand, inshallah. I think I've lost you. So if you raise your hand again, I think it's Shakira, I think. Shakira, I'll allow you to talk. Okay, you can talk now, Shakira. I think we've lost you. Okay, inshallah. As there are no further questions, so on that basis, what I'll do is I will leave it at that. My time is over. We've gone well exceeded. Hopefully that's been very, very beneficial. Inshallah, this will be coming out as a document. I'm not too interested in being responsive to something, but there are serious lessons that we need to learn from this. So it's more about producing some work that will be in response to the lessons that we're learning from it, rather than fatwa and something that's coming out and addressing immediate concerns. And there are plenty of people who are doing that work, alhamdulillah. So inshallah, hopefully it's been really beneficial, and things to take into consideration. That's the most important thing from this. Jazakumullah khair. Assalamu alaikum wa rahmatullahi wa barakatuh.